I think the timer is running. We can start.
Okay. Oh, sorry, sir. Okay. Hello, examiner. My name is Jachi Moses, GMC number 7703068. Hello,
Hello, doctor.
I'm Dr. Jachi. I'm one of the junior doctors in the surgery today. Can I please confirm your name and age?
I'm Kristen Blake. I'm 30 years old and I have this terrible pain in my finger, doctor. Please help me.
I'm really sorry about that. Are you comfortable to talk?
Yeah, but please just pop this blister out of my finger and just relieve me from this pain, doctor.
I'm really sorry about that. I'll just try to ask you a few questions just to understand what's really going on. I'll be real quick and then I can give you the help. Would that be okay?
Yes, doctor. Please do help me.
Okay. All right, Christy, you mentioned that you had pain in your finger. Can you tell me what finger it is?
So it's my ring finger, doctor, and in the tip of this ring finger, I have this blister which is very painful and I'm not able to do anything.
I'm really sorry about that. And when did it start?
I think it just came out suddenly out of the blue 2 days back and very painful.
Oh, I'm really sorry about that. Then and can you describe the pain?
So it's kind of sharp pain. It's very severe, and it's right where the blister is, and I couldn't do anything.
I'm sorry about that. And can you tell me like if you were to score the pain, with 1 being the lowest and 10 being the highest, could you score it?
Maybe around 7, 8.
Oh, that's quite a lot. We'll try to get you something to take care of the pain. Okay. And you mentioned that you had the blister there. Has there been any discharge from it?
Not much, doctor. It's just
Oh,
red, and it's just like that.
okay. And has it changed since you noticed it?
It's just the same. It's how it was 2 days. So before the 2 days, I just had a tingling kind of a sensation. It started as of a rash, and it just became like a blister, and it's just painful. Can you just pop it out for me?
I know. I'll take a look at it and see if we can actually do that for you. Would that be okay? Okay.
Yeah, okay.
All right. You said you started with a tingling sensation. Have you had anything like this before?
No, doctor, I haven't had something like this before. I just used to have these cold sores on my face, on my lips, and just things like that. But this is new, I think.
I see. Okay. Do you have a presently apart from the finger? Do you have anything like this anywhere else?
No, it's only on my ring finger, doctor.
All right. Thank you. Do you have any other medical conditions you're being managed for?
No, I think apart from the cold sores which I had, I don't think so anything else.
Mhm. And what about any medications? Are you on any medications for it?
No, doctor.
Okay. And do you have any allergies?
No, not that I know of.
Okay. Have you had any hospital admissions or surgeries in the past?
No, doctor.
Okay, thank you. All right. So I'm just going to ask you a bit about your personal and social history. I'll be real quick, and then we can see how to take a look at the pen and the finger. Do you take any alcohol or smoke?
At times, but not much.
Okay. And how has this finger affected your physical activity?
Yeah, I am not able to hold anything or touch anything. It's extremely painful. I'm not able to do my day-to-day activities.
Oh God, that was really stressful. I'm really sorry about that. Okay. Thank you for everything. Is there anything that you'd like me to address that you think I haven't addressed yet?
Yes, doctor, I just want you to pop this blister and just relieve me from my pain. And, this is really upsetting me a lot.
Okay, I understand. All right. First of all, I'd like to examine you. Then I can take a look at the fingers, see what it's actually see what the fingers like. I'll be looking. I'll just feel around to see what the fingers like and see if we can actually do that. If that's the best way to manage. Is that okay?
Yeah, that's okay.
Okay. All right then. Okay. Thank you. Okay. Okay. All right, Christian. Thank you very much. Okay. I've taken a look at your finger, and I've also seen that you have a high temperature. So I'll be taking a look at how best to manage you now. Is that okay?
Yes, doctor.
Okay. Well, first off, from everything we've discussed, from what you said, and from the examination we've done, and also the history you gave me about having cold sores in the past, I think you have a condition called herpetic weight loss.
Oh, what is that, doctor? Is that
Well, it's an infection that can happen anywhere else, but in this way, it happened in fever, which is why the Whitlow is there. Hepatic Whitlow. It's a viral infection, and it's usually goes on its own. It causes its own. Like for instance, you mentioned earlier that you had some cold sores, so sometimes it comes and then it goes away on its own. But in this case, sorry, I can't remember. How long ago have you had it for?
I have had it in the past 2 months. I've been having cold sores in the past 2 months, on and off.
Okay, this finger, has it been more than 2 days? How long have you had this finger infection for?
It's just for the past 2 days, doctor.
Okay, thank you. Sorry about that. I forgot about that. Okay, so since it's been the past 2 days now, would have to give you, well, first of all, take care of the pain. I know you mentioned popping it, but in this case, we can't pop it because it actually makes it worse. It will be well we can do. I'll give you something for the pain because the side is very painful. I'll give you something for the pain, and then I'd also give you some antiviral medications, which would also, since this is a viral infection and it's just been within 2 days, so we'll give you the antiviral medications rather, just to help with that. Aside from that, you should just keep the area dry. Keep it dry. Don't try to pop it. Don't try to pop it so it doesn't get infected or gets worse or spread. In the meantime, you should also stop from much contact with your hands. If you're going to do anything that might get it sweat soggy or more inflamed, you should try using a glove or so. Is that okay?
But I just want you to pop it. I think it'll just go off, right? If you just pop it, and it just makes me feel better immediately. So why are we doing all this, doctor?
I understand your concern, and if it were a case where it was more fluctuant and it was, a different kind of infection, we would have just popped it, like done a drainage for it. But in this case, it's really best to um let it, go off on its own while we manage the pain and give you the medications. It should go off and get better.
And is this the thing, herpes, which causes a sexually transmitted disease? So will it affect something related to my sexual life? What do you think about it, doctor?
Well, in this case, the thing is that it can come up from time to time, and yes, there are different kinds of infections. There even like the sexual ones are caused like herpes, but in this case, sometimes it's more like it's something that we start like from the like yeah, like a previous sexual infection could like maybe start up again and then this happens. So yes, yes, it does have a link to that. It does have a link.
Move on to the next station.
Thank you very much for your time.
That was really good performance, Dr. Jackie.
God.
So how do you feel about it?
Wow. I was at some point I kind of forgot what I was doing. Like I was like trying to like make sense of it. I don't know. I think I got lost in the management and part of the gathering. I didn't know what else to ask. I was thinking, should I ask about sexual history or should I not ask about sexual history? Sorry about that. That's my daughter.
Yes, that's
Yes,
okay.
it's all right.
Sorry about that. Sorry.
Yeah, so yeah, your IPS was really good. You were very calm throughout the station, and there's just a little things that we need to improve, but overall it was a great performance. So you're on the right track. You're doing good.
Thank you. Thank you.
Yeah, so I will pass it on to the examiner who will be giving you a detailed description about how you did and what could be improved, right?
Okay, okay, that's fine.
Yeah,
Thank
all the
you.
best.
Thank you. Thank you, Dr. Devi.
Yeah, thank you.
All right. Thank you, Dr. Nevi. Hi, Dr. Jachi, is it? Sorry.
Yes, yes.
All right. That was really good.
Thank you.
I really like the way you, frame your sentences. You have that, the way that you talk confidently. That's really good. Keep that up.
Thank
And
you.
one more thing, but one thing I noticed is your sentences are really long and really fast. Uh,
Okay, okay, okay.
so sometimes it gets a little difficult for it's not that it's bad, it's because in an exam like this where the examiner need to clearly hear you, otherwise you won't get marked.
Okay.
So
Okay.
this is something that can hurt you if accidentally the examiner didn't understand you properly. So
Mm-hmm.
make sure you always give a break between every sentence you tell. So you
Okay.
say something, you wait for the patient to respond, and try to speak a little slower. That just comes with practice. Try to enunciate, especially it only matters when you're explaining things. When you're
Mm-hmm.
asking questions, it's all right. You can talk normally, but especially when you're talking in medical terminology where you're explaining the disease and the treatment,
Yeah.
always try to give it one by one sentence by one sentence.
Okay.
Always try to say, is that okay? Did you understand that? And then you only go to the next one. But
Mm-hmm.
other than that, it's really good. I'll hand it over to the examiner.
Thank
Thank
you. Thank you.
Hi. Hi,
Hi.
Doc. So you got handed over like 3 times now. That
Yeah.
was a little introduction. Okay, Dr. Niveta is saying something. Long questions also affect how time management.
Mm,
Just continue reading that. Affects our time management.
yeah.
Short, direct questions saves our time. That's very true. In
Mm-hmm.
fact, because the main purpose of this exam is to allow the simulator to talk. So you
Yeah.
should just ask them start with open questions like how long, I mean, how is this affecting your life, or
Mm-hmm.
how is this affecting your daily activity? In these short sentences, they will say a lot of information. This is an open question that they can actually, express themselves very well. Where
Yeah.
you're not saying much, but you're getting out a lot.
Thank you. Thank
So
you.
that's also true. And that's another thing where when I was marking you, Dr. Rohit mentioned that you were a little fast. So while
Yeah.
I was marking you, I couldn't understand what you were saying. So it would definitely affect you,
Okay. Yeah. Yeah.
right?
Yeah.
So the
Sorry.
main no, absolutely not. This is a place where we can actually understand, how to improve a consultation. So
Yeah.
always happy to help. So one thing that I would advise you is that think of the patient as somebody who you need to explain this condition to properly so that they can take care of themselves, right?
Mm-hmm.
You won't be going home with them. You can't tell them what to continuously do. You have to give them good instructions.
Mm-hmm.
Yeah. So all right. So I've just muted you, Dr. Moses, because I'll just explain once. And if you have any questions, you can raise your hand like this. So you can always click on that hand button, and then you can ask your questions. Is that all right? Okay, awesome. So yes, moving on to the explanation of the condition. So when you first understood, when you saw the case, I just wanted to go through that once. Sorry. So we are conducting our mocks right now using our product that we have built for PLAB 2. We've collected a whole lot of cases and we've tried to display it in a way where people understand it better. So in your candidate information, if you see, the only information that you have is that this is a middle-aged man who has pain with his finger, right? With this information, you can think of all the differentials while you're standing outside in the cubicle for 1.5 minutes, because quite frankly, you don't have much to read. But you can think of all the things, all the possibilities that it could be, right? There's not much information given, but what all could present with a problem with their finger. It could be for a 30-year-old man. So it could be a trauma that's something that would come to mind. It can be any infection like pyonicea, or you can think of Whitlow in the infection phase. You can also think of autoimmune diseases where it could be infective endocarditis. There could be those Osler's nodes, and you can also think of autoimmune diseases, right? Like the Heberden's nodules or the Bouchard's nodules. So those are the things that you can think for rheumatoid as well. So you have a whole lot of things that you can think when it comes with the problem with the finger. So now you have to have these differentials in mind while you're going in, because this person you are going to consult, you're going to think about what this problem is. So before you even start the question, you need to ask them first how, what the problem is and how it's affecting their life. Because other than disclosing or understanding what this is, you need to understand how this problem is affecting this person's life and make it better for them, right? So we have an in time guide which will take you through the entire consultation in 8 minutes. So let's go with the in time guide.
Begin. Begin. Enter the room.
Right. So you started off when you entered. You started off by introducing yourself and explaining your role. That was amazing. You were. It's like entering any consultation room. You have a certain information about the patient, and you have to interact with them to get to the bottom of what it is and how you can help them better, right? So that was very well done. You empathized for the pain and distress. That was amazing. Your interpersonal skills were just on point, I have to say. And you acknowledged the pain. You asked him if you needed medications, which was great. And you want to ask about the main issues. What is it that's kind of affecting him right now? So as soon as you started talking, Dr. Niveta, who performed so well, she immediately mentioned that she wants to pop it. So it's like that's like the knee jerk reaction to something so big and filled with some fluid. So you feel that as soon as you pop it, it'll be relieved. So that is the persona or their mindset that they're coming with, that I need to pop this. So the first thing that you need to think about it is, what is it? What will happen if you pop it? Because that is their main concern when you're coming with up when you're actually addressing these questions, the idea, concern, expectation. They've literally given you their concern immediately, even without you asking. So that's kind of like a thing to initiate your management, or gather the right information for the management. So, all right, so that is what should be at the back of your mind to address whether you can pop it or not. And the next thing you have is the Socrates. So now you need to understand a little bit about the case. You have a whole lot of differentials in your mind, and now you need to narrow it down to what it could be. So the important question is the onset, which you asked very well, and how suddenly it came in. Is it changing in size, shape? So she said it was sudden, and then initially it was like some, it was a numb feeling. You're like, all right, has this happened before? Like, not really, not in my hands. But she also mentioned that she's had cold sores. So if they don't actively give you that information, you can always ask that, have you had any medical conditions in the past, which you also did ask, and any medical medications, because you need to understand any other relation that it could be. So if he had rheumatoid arthritis, if he has endocarditis, those are the things that you can relate, that do you have any medical conditions. So if he says no, he doesn't know of any medical conditions, that's all right, because he's a 30-year-old man, and this could be the first presentation of one of those medical conditions. So it could be an already existing medical condition, or it could be a early presentation of a new one, right? So your understanding, is it related to any condition? Is he taking any medications? So after understanding all that, you could narrow it down to the fact that he only had cold sores. That is one clue that you've uncovered. It was a very sudden nodule, and you went into how it's affecting their life. So he can't hold anything because it's very painful. So it's an acute onset as well. It was 2 days, it was sudden. There was history of cold sores. By now you must have actually narrowed it down to infection. But now you need to understand, is it pyonychia, or is it supposed to be herpetic Whitlow? It looks more towards herpetic Whitlow. But have you had any recent traumas? Right, because that's the first thing that should be in your mind as soon as it's like the finger, because they might be having some cut which could become an infection. It could become a pyonychia, or it could become a staphylococcal Whitlow. So Whitlow is something that affects the nail pad. And when you're talking about pyonychia and all that, those are affecting the skin fold around. So a pyonychia can actually become into a staphylococcal Whitlow. So in this case, that is not even the presentation. So you can actually rule that out. You can actually be more confident in saying that this is herpetic rather than staphylococcal, because there was no history of trauma. There is no. We have one doctor joining us. All right. So there is no presentation with any trauma. So you can kind of understand that it's not something that is related to bacterium. Because another thing, then you went into the examination where you asked for the findings. So the findings, let's take a look at the findings. So in the findings, you can see the high temperature. We should have mentioned it better. The high temperature was in the local examination. But so the other things that you did rule out was you could have ruled out was, is this an active infection affecting the systemic the other systems. So that also you could have understood a little bit. Is have you been feeling any other symptoms like fever, any soreness, or anything, right? So, because those are also very important findings for infective endocarditis, right? So, so then you understood, right? No, he didn't have any of those, but local examination, it's hot and it's tender and it's red. You know, those are all our classic inflammation signs. So after understanding that, you could deduct it, and there is no, it's blister, it's not pus. So you can actually come up, understand that it's more likely viral. So then, you know, you for sure understanding all this, asking all these questions, you've understood everything in the realm of a herpetic Whitlow case. And you need to, the other thing that you need to understand is, since it's herpetic Whitlow, that means he has had cold sores, right? It usually gets transmitted by skin contact, right? So now you need to understand that this person is not a health hazard, because if you know, especially if he's out in the community, what all advice should you give this person, right? Because this is a person that you understood has been having cold sores, so then he has herpes in his system. So herpes is a kind of it's a virus which once is, if it's contracted by somebody, it doesn't go away, so it remains dormant. So when it reactivates, it kind of has these presentations like cold sores. Now if you itch the cold sore, you will have a Whitlow. So it's something like that. So you need to understand that contact needs to be reduced, which you addressed very well. Good, that was very well done. So contact needs to be reduced, and also other than the local contact, you also need to address the sexual history as well. Like why, if he does have this, so that means it's reactivated. So try to abstain from sex until you actually this kind of symptoms come down. So you have to aggressively treat these things. So then you are giving them antiretroviral medications, because the medication actually reduces replication of these viruses. So when that happens, so then you're reducing the chance of transmission. So until these symptoms go off, please try to abstain from any sexual intercourse. That is something that you need to mention. And the other reason for reactivation. So now you need to think about, why this reactivation is happening. Because usually these reactivations happen in high stress conditions, in if they are immunocompromised, if they have any other, if they're taking any medications, any immunosuppressants as such. So that's when the reactivation happens, because when the immunity is not containing them or is unable to contain them, so you're giving more reinforcement in the form of acyclovir to contain it better, because once you contract it, you can't, it stays in your system forever. Yeah. So that's how you need to address these things. So you understood what the disease was, you understood what the medication needs to be given, and the main concern was, can I pop it because of the pain, right? So another thing, so you need to explain that I'm so sorry, you cannot pop this, mainly because it can get worse, right? Because it can transmit, it can go to other places, so you're actually giving access to the fluid filled with virus to go anywhere, or get have other contact with places. So the symptoms, we can reduce it by giving you medications that will reduce the symptoms over time, because the replication is stopped. And we can give you other medications for the symptomatic control, like for pain, right? So that way you're containing the pain, which is the main problem for this person. You can also give them some advice, like some cold compression, so that the pain can be handled locally. right? Because over a period of, because you're giving antiretroviral medications for a period of about 7 to 10 days. So in that time, it should reduce. But if it doesn't reduce, you always come back to us and we'll see what further we can do, right? Because if we are going to incise and pop it, it's only going to get worse. But if it comes to that, we can deal with that, right? So that's what the first line of treatment needs to be given in a way where you're like, this is the first line, this is what we would ideally do to approach this, and we'll help you out with the other symptoms that you are facing. And but if it doesn't work, come back to us, because we will find a way to manage it no matter what. That's the reassurance you're giving them, right? So what all are you doing? Just to summarize it, you're understanding what the case is, you're addressing this person's concern, you're addressing how it's affecting their life, and you are also giving them an option of, if this is the treatment, if it doesn't work, please come back to us, we are still there to help you, right? So that's the kind of consultation that you get marked for, your interpersonal skill and your management, right? Because your data gathering was great, but it was a little long. And the important data gathering that you didn't do was about the sexual history, which Dr. Niveta did bring it in after a while. But yeah, you should ask that, because you're sending this person into the community, and it shouldn't affect the community as well. So you need to tell them how to contain it, right? Yeah. So do you have any questions, Dr. Moses? I'll just you can unmute yourself. I'm sorry, I'm muted.
No, I know. I know I don't have a problem with like data gathering because I felt it was taking time. And then when I got to the social history part, I was like, do I ask sexual history or do I not ask? I wasn't sure, but I get it. I get it. I get it. Thank you.
Yeah, so in this case, sexual history would be important because this is reactivation of the virus. So the virus will be there in the fluids. So you need to tell them that you are going to get medicated for this, so that we reduce the replication rate of the virus. So when the virus gets more contained by your immune system, and it comes to a point where it's not transmissible, you can definitely do engage again, and but make sure to use protection, because these are the cases you have to emphasize on the fact, every time you have a sexual encounter, please use protection, right?
And anything else?
Anything else? Anybody wants to add anything?
Yeah.
Instead of hospital admission questions, we can ask about sexual history. That's something that Dr. Niveta was also mentioning. Yeah, that's also an important point.
Yeah, you can learn to prioritize which questions to ask. Like, for example, the smoking and alcohol might not have been that important in this case. So always try to see which. So that all that helps, especially in while you're formulating your data gathering itself in the before you enter the station. So once you enter the station, you don't have much time to think. You have to be very spontaneous. So what usually helps me is, after I ask all the questions, after I ask the differential questions, I try to repeat it back to them before I go into further questions, because that way I can formulate more in my mind. So all we have to do is, so you mentioned you've been having a blister on your finger and it's been 2 days, and you also have a, history of cold sores in the past. So if you just say that back to them, it will take you maybe like 20 seconds, and then meanwhile you can formulate what you need to ask next. So that is if you get stuck. Otherwise, if you already have questions in your mind, just keep going, because don't waste time in summarizing. All right.
All right, Dr. Moses.
Thank
Good luck.
you. Thank you.
Thank
Thank you
you,
so
And
much.
thank
Thank
you
you.
everybody for joining.
Thank you for choosing Turing Med School. Good luck with your preparation.